Here comes the Clarity series brought to you by Inspiration Side and hosted by Chris. It's about to be a long ride, and I guess you are very ready to get some clarity, discover, recover, uncover, and don't forget like, comment, share, subscribe, and turn on your notification bell.
Welcome to another episode of the Clarity series, and I guess this is going to be like the beginning of our off production. So we are back, and so we are starting with this very amazing recording, a very amazing concept, and I believe you're going to learn a lot, and you're going to like know more and appreciate this particular one. So it's my pleasure to bring on board. I call her Gift. She will say her name in full, so I don't say it wrongly. Hi, Gift. Can you pronounce your name correctly?
Okay, thank you so much. Good morning, everybody. My name is Ofeoritse Amoshuka. Good morning, good afternoon, good evening. I don't know what time you might be saying this, but my name
Yeah,
is Ofeoritse Amoshuka.
okay. But for the sake of this recording, I'm just going to call her Gift, so we don't
Okay,
talk
well,
about the name. All right. So Gift is a student radiographer with strong interest in medical imaging, healthcare and education, and career development. She's passionate about helping students gain clear and accurate understanding of radiography, including its academic demands, professional responsibilities, and career opportunities, with a strong appreciation for learning, ethics, and personal growth. She brings a thoughtful and practical perspective to conversations around healthcare and purpose driven career. So, welcome, Gifts. Welcome to the Clarity series. We are glad to have you. Um,
thank you so much.
yeah, so I'm going to say a background of how I met Gift and why she's here. So, she made a post one day and she was like, she's a radiographer, not a radiologist. And yeah, I'm a science person, but it just felt like maybe I would have said those two words were no, not homophones, like they were synonyms or something. But when she made that post, I had to reach out to her, like, what do you mean? Why? What's I thought is radio, like I thought it was the same thing. Then she said no. So I said, okay, let's just pause that conversation there. That she would come up here to tell us what really is the difference. So let's start from there. What's the difference between radiography and radiology?
Okay, thank you so much, Ma. So first of all, I would say I am not a radiologist. I am not going to ever be a radiologist if I continue in my practice. So first of all, while I was at home, somebody reached out to me. I was like, oh wow, you're not a doctor. I was like, no, I'm not a doctor. I cannot be a doctor. A medical student, somebody that was studying medical anatomy, or I don't know, I think it's human anatomy, reached out to me. I was like, oh my doctor. I'm like, I don't understand. You're even in this field. So how do you not know the difference between a radiologist and a radiographer? So a radiologist is a practicing doctor, somebody that went to the university, studied medicine for 6 to 7 years or 5 years. I don't know how long it is now. Finished medicine and specializes under the radiology field. I personally, I am a student radiographer. I don't need to go through the course of studying medicine before I can be called radiographer. I go through 5 years of college where I learn everything about the human anatomy, the body system of my in the area of specialization under radiography. So radiography is the science and arts, or I am a radiography. Sorry, I'm a radiographer, and basically, what I do is that I visualize the internal system, the internal body parts of the body before any treatment or diagnosis is made, so that doctors, mostly these radiologists who have gone through the walls of the university studying medicine, now have the ability to interpret my imaging so that they can bring out treatment and diagnosis to the patients that came to me. So basically, what I do is I visualize the internal body system using ionizing and non-ionizing radiation, which includes X-ray, gamma rays, like and different other modalities in my field in radiography. When I do this, I bring out an image, most times a plain radiograph that has been heated, ionized with ionizing radiation now has produced an image in the radiograph. So when I do this, I now then transfer this file to the radiologist who now has the ability to now interpret what I have done. Although I may have known the knowledge of interpreting, but because I don't have the license yet, which those radiologists have, is now why I cannot meet a patient and interpret this radiograph to them. So radiologists, they interpret the radiographs that we bring to them. While me as a radiographer, I'm the one that does the process whereby the radiograph can be produced. Most times it's not, I'm using radiograph in the sense of x-rays, which most everybody knows. But there are other things like sonograph, which is like the one for ultrasound. But I'm using radiograph as like the plain term. So yes, ma'am. Radiologists, they interpret the images, they go to school, study medicine, radiography. I do the process and everything in between.
Okay, that's nice. So I would say as a radiographer, you have limited access or like relationship with your patient, but the radiologist would interact with patients and like explain whatever you see, right? You don't
Okay,
really.
no, we have like almost as much interaction with our patients because
Okay.
there is a course called patient care in
Yeah.
radiography. We do it. I think we did it last year when I was in my 300 level, and we did it because as radiographers, we are the ones that position patients for the imaging they want to do. We are the ones that tell them what to do, how to position themselves. If they are doing this, if they don't have this in their body, we tell them what the examination is going to look like.
Mhm.
What the radiologists do is just that they interpret this radiograph most times to the patient. It's not like they are the ones that position the patient for the imaging or the examination, or is it they are not the ones that meet firsthand the patient before the radiograph gets to them. We are the ones that meet them when they are directed to this field. We meet them, we take care of them and make sure that they are well positioned for the positioning of the examination we are going to perform on them. Yes, ma'am.
Okay, thank you for that clarity. That's great. So there's something I've heard, which is radiography is the eye of medicine. Can you like
Yes.
because it makes it seem like you people are proud that you people are the eye of medicine, a whole eye, Abby, yeah, a whole eye of medicine. So how are
I
you?
think we're supposed to be proud.
Yeah,
Yes, we're supposed to be proud.
you're supposed to be proud. Okay, how are you the eye of medicine?
Because in plain terms, I said that before any treatment or diagnosis is given to a patient who needs a radiograph to be interpreted to them, we are the ones that actually visualize the internal system. Like you don't just need to give out doses of treatment. Maybe somebody has a broken bone, a fracture, for instance, and you don't know where this fracture is located, even though the person can feel it. We are the ones that make sure that the exact location of this fracture is done. Now we now have an advanced sort of X-ray whereby we call them computed tomography. These ones can visualize the internal structure, even show you in a 3D structure, whereby we now slice through most of the tissues and everything, and and like get whatever is going on in the body, even if it's as small as an atom.
Okay, okay, well, that's brilliant. It's it's okay. Thank you for being the eye of medicine and for letting us know what is happening inside. It's so
Thank you.
interesting. So there's another principle or concept of radiography, which is something personally I'm a little bit concerned about from things I've heard, and I think we'll just start from there and enter the concern. Um,
Okay.
as low as reasonably achievable. Alara,
Yes, ma'am.
so would you please tell us more about that principle? Like, what's it about? Why is it necessary?
Okay. As low as reasonable, achievable. It's a principle that a radiographer needs to understand the concept this semester, I think since I was in my year two, when I was introduced into the field properly, I have been learning this every single semester. It is under mostly the radio biology because radiography deals with a lot of exposure, with a lot of dangerous activities. So when a radiographer consistently hears this principle and understands it, it makes him or her have the understanding that this is needed in the field. So as low as reasonable achievable is that before you expose a patient to radiation, it needs to be the lowest dosage that can give you the required image that you need, because radiation is dangerous. So before you expose your patient to radiation, you need to understand the do's and don'ts. Is this the most reasonable approach to it? If there are other alternatives, you can use it instead of you exposing your patient. But if you now then have to expose your patient, it needs to be the lowest dosage that can give you what you require.
Mm.
So that is why this principle is needed in radiology and radiography, because it's something that a radiographer needs to know before exposing a patient to radiation. Is this the lowest dosage that can give you your required image, that can give you the required quality of image that you need? And if it's not, you can then reduce it to the lowest one that can give you that required image. Because even if you want to say, oh, I want to reduce it, I don't want to give my patient the dose that can kill, or no, not can kill, that can be dangerous, then you reduce it too much, you will now have an underqualified radiograph. Then you don't have to redo it. So instead of that, you need to know where you stand in between, not so that it will not be overexposed and underexposed. So that's why this principle is like always constant.
Okay, that's nice. Thank you. So while you were talking, I have just one very funny question that I wanted to ask. When you
Okay.
mentioned radio biology, so I wanted to ask, like,
Yes.
in the course of learning, because it seems like radiography is more common, like in human. Do you take a course, or do you do things as you like radiography in animals? Like, is there anything like that where you like check?
Okay. Okay, so up till this moment, when I've done oncology, that's like treatment of cancer, I've done radiophysics, I've done radiobiology, I've done a lot of things in radiography. I don't
Yeah.
think we have actively looked at animals per se. We are most dominant, like our course is like in human, like
Yeah.
because radiography is not just limited to the medical field. We can use radiography in we can use radiation in industries where they make these pipelines. There's a way they do it. We can also use radiation in security checks in places like airports. So like in all that, we are not taking it into those diverse fields. We are just specializing under this particular one, that is medical imaging just for humans. Currently, I think that's what we do in my own school, because I don't think I have actively learned how to perform a radiograph or do a radiography examination on a rat or something like that. So yeah, it's just limited for me currently to the
Yeah.
human field.
Okay, that's fine. So now,
Okay.
from the other principle that you are trying to minimize the like exposure of your patient or of like any individual to radiation, how then does a radiographer protect himself or herself? Because I mean, you are also probably in the same room there when you are guiding your
Yeah.
patients to do this way, position yourself. And sometimes we have scattered rays that while it's going through, it just scatters and like goes to every other part of the environment. So as a radiographer, how exposed can you be as well in the course of you trying to attend to your patient? Does this seem like a
Okay.
very dangerous career? Does it?
Yes. It's actually dangerous because I think because I'm about to go for my assignments, and there's a lecturer that always tells us, be careful, oh, if you know you want to give birth in the future, be careful, oh. Like it's not only one person, it's not two people, it's not three persons. So there was even a time that I was so shocked in class. Then my lecturer asked me, why are you laughing? What is funny? What is fascinating? He told me to ask him a question. I was like, sir, do you mean that I am definitely going to receive radiation? He said yes. So the thing is that there's a meme that came out last year that I saw. It might not be like reasonable to a lot of people, but in that meme, when the radiographer finished positioning the patient, and he was like, "Oh, it's not going to be painful. It's not dangerous." So one of his colleagues then locked the door in where the patient was, and the radiographer was just shouting because if they had exposed him, he would have been exposed to
Oh,
the particular amount of radiation. So the thing
yeah.
is that we are not in the same room per se. There's something called a cubicle where every radiography center must have. Every X-ray room must have a cubicle. When we did radiation physics, physics, sorry, there's like it's a whole ball game because there's calculation. The amount if you're not using lead because lead can block radiation. Yes, lead is a metal or a element that can block radiation. So there's a particular amount of kg, a millimeter, like there's a particular amount of measurement that you need to have when you are building your cubicle. Well, if you don't have lead, you can use another aluminium, but it now needs to be larger. So like in building a X-ray room, it's not just normal building where you just use cement. You need to call a radiation physicist, somebody that calculates the amount of aluminium lead sheet to be used. Because if you don't do this, and the radiographer is always exposing the patient with just small thing as cement or block being the shield between them and the radiation passes through those kind of
That's
blocking. So like
oh,
the whole ball game is that there are lead sheets, there are a lot of things that we use in blocking radiation. And when this is actually not the only thing, there's something called lead sheets. If somebody goes to the radiography room and he wants to expose somewhere close to his gonad, like his reproductive system areas, they tend to give you a sheet, like a gonad clothes that covers that area because of the fact that those places are radiosensitive. Like there are places in the body, organs in the body called radiosensitive and radio resistant organs. It's like something different. But they give you this thing, and if you even want to lift it up, you see that it is very heavy because it contains lead. So those aprons, gonad sheets, aprons, everything, they are also used by radiographers when they want to perform an examination to protect themselves too, because we understand the concept of scattered radiation and how it is not just limited to the environment and like it can pass through. So we do all these measurements, we do all these calculations, we wear all this protection because in as much as we are protecting ourselves, like consciously, this radiation still leaks out in one way or the other.
yeah, that's very true because sometimes I just feel like it's quite true that some careers are just difficult. I mean, it's just like
Mm,
during COVID, and we had specialists like medical doctors who would be in the what's that English in the quarantine centers. Is it quarantine?
yes, yes.
Yeah, and sometimes I'm like, you are in a room full of COVID patients. How are you sure you're not going to get it? Or
Yeah.
doctors who treat, yeah, or doctor who treat HIV patients. I'm like, any blood spill on your
Mm,
maybe you have an open skin or something. You are
yes.
doing your work, but like those are like work hazards. So radiography is just one of those things because of course you can't see the rays and you can't tell, oh, the ray is passing through this place, I will run the other way. It's not possible. But
Although there's
that's
also like a protection called dosimeter. Dosimeters are what, although it is not as if it's 100% effective, because I don't think they have produced a protection that is 100% effective. That's why like radiographers still collect small doses. But like this dosimeter is put in the body of the radiographer. So after a while, there's a way they measure the amount of radiation that the radiographer has received over time. It can be
okay.
put in the breastplate, in the wrist as watches or something like that. Yes, ma'am.
Okay. Oh, that's
Yes,
that's
ma'am.
nice. That's nice. So you can keep track and not like it will get too much before it will be too late before they discover that. Oh,
Yes,
yeah,
yes,
something
yes.
is too much. Okay, that's reasonable. Thank you. So
Thank
I think
you,
that's a funny
ma'am.
question. Do you think because we're in a growing world of tech and AI, do you think AI or tech will like take away the job of a radiographer. And I'm going to explain why. So I had a tuberculosis test last year in an hospital in Lagos, and yeah, the cubicle you were mentioning. So I came in through a room. I saw the radiographers seated somewhere, and they told me to go into the radiography room, if that's what we'll call it. So then there was just this machine. I think the only thing the lady told me was remove your clothes or something. She gave me an apron, like a protective wear to put on. He said I should go in that the machine would direct me as to what to do. And really it did. Like it was like, okay, stand here, lift your arms, do this. Like it
Wow.
was I'm serious, it just gave me all the guide and like did what he wanted to do and told me it was time to leave. And like I just left, went to change my clothes and I stepped out. Like
Wow.
I'm serious, none of those guys entered the room with me. They were only seen from the cubicle and like probably controlling or whatever. They were not in the room with me. So have you thought about it that is it possible that at a particular time tech or AI would probably, because I mean it's already affecting some careers, yeah, like tech is like displacing people. So have you thought of it like is it possible?
I've actually thought of it, and I think one of my strong points was me telling people. So imagine you see a computer telling you what to do. Will you be able to allow it, something like that? But just your point alone has proven me to an extent wrong. So I think one of my answers to that is that last year we did AI in radiography, talked about AI, we talked about the algorithm, how when we keep on feeding it data, it now gets better and better, and it can now do most of what the people that interpret radiographs do. Those are the radiologists. So at this point, I can say that for the work of a radiologist first, which is interpretation of data, AI can do that, like
Yeah,
even more accurately than a radiologist. Another
yeah,
aspect in the field where AI can come in is also in the concept of revenue income. Because if AI can do that, what's the need of a hospital employing radiologists? So like it now makes their revenue bigger. But in the aspect of radiography, you already beat me to it. I wanted to say, oh, I cannot allow an AI to be the one to direct me. But AI, even as efficient as it is, it has limitations. It has like I use Claude, and Claude has limits and everything. So like to be on a very safe side, I personally think that AI would take the jobs of those who don't know how to use it. Because in as much as the AI is the one telling you what to do, there is somebody that programmed it. I know
yes,
most people can do it, but this works specifically for a radiographer. So, like
yeah,
those that will actually be more advanced in AI usages are those that now they now upscale, they now
hmm,
learn how to use AI. They are
yeah,
not just limited in like just the locality of where they are, or like the localization before AI. They now
yeah,
do their research. They now know how to include AI in positioning, how
yeah,
to do the algorithm in a way that will favor them. So yeah, I would say that AI can take jobs of people that actually don't know how to use it. So yes,
yeah.
that's my answer to that one.
Yeah, thank you. That's actually true, and that's probably like not just in radiography, across a number of careers and anything we do. If you know how to use AI, then most likely it can take your job. But if you're able to use
Yeah.
it to your own advantage, really, then I think another thing for medical field and why tech and AI may not be able to take everything completely would be the emotional aspect. Like you said, would you be okay with somebody say raise your arm, this compared to somebody that like maybe you were crying before you came into the radiography room and you know what, just be calm, just calm down. It's going to take a while. Like all those soft words from a person.
Yes.
But AI is not going to probably know that you were crying or you were angry. It's just going to give you straight up instructions. So that's
It
nice.
made me remember that last year we also did a course called psychology radiography, where we talked about the Maslow's law of needs, We talked about how to communicate to your patients effectively. We talked
Yeah.
about a whole lot in psychology of patients in radiography. So that's actually another aspect, the emotions.
Yeah.
For ambulance patients and patients and everything, the chances of AI giving them right positioning is very slim because patients like that, they are not prone to the effectiveness or the speed of these AI machines. So yes, another aspect is emotions, is empathy and communication.
Yes. Thank you so
Yes,
much. Thank you
ma'am.
for this clarification. Okay, so we're talking about radiation and sort of, not to say in a way that's probably scares some people. So I want you to like shed light on the different types or the different aspects of radiography, like the ones that use
Okay.
like x-rays, the ones that like maybe use sound or something, and like just to ensure like people know that it's not everything radiography that is as dangerous as possible. There are some that,
Uh, okay, I understand, ma. So we are doing a course called computer tomography, and in that course, um my lecturer made a note on, like, it's called contraindications, areas where you cannot use computer tomography.
okay,
So like the last on the list was pregnancy. Like on no account should you expose a pregnant woman to radiation using computer tomography, because radiation is like, it's something that affects the body. We have like different effects of radiation. We have the somatic effects, we have the genetic effects. Somatic effects are those effects that they are not generational. They just build up over time, and they can come in redness of the skin. They can come in a lot of different areas. But genetic are those that like tamper with the genetic system. And even though this does not happen to you, it will happen to your generations. Something
okay,
like pregnancy, the baby in the womb, it can cause different genetic effects. So the first is that we have X-rays, and we have those that use ionizing radiation, and we have those that don't use radiation. The ones that use radiations are cases like X-rays, computed tomography. These ones, they use radiation to internalize, to view the internal system, and like
yeah,
they are very dangerous to if they are used in large proportions. That is why the alarm principle is there. But they don't use it in pregnant woman at all. Not mostly because of her, but because of the baby she carries. Because like the baby system is not yet built up to like withstand even the smallest radiation in a way. So that is why we have things like that. Is why when people say, "Oh, but why do we now use ultrasound?" Ultrasound does not use X-ray radiation. What ultrasound uses is what we call sound waves,
hmm,
because there are like three types of waves: the ones that we can hear, the ones that we cannot hear, and the ones we have like we do it in megahertz and hertz. So like the particular ones that we can hear, that is what we use to visualize the body, like
okay,
visualize the places that we want to use. And what helps us with those sound waves are what we call sorry, somebody is trying to call me, like, so Marcus, can you hear me?
yeah,
Like those are what we call ultrasounds, where they use sound waves to visualize the internal body. When
yeah,
we don't, they are not exposed to X-rays. What they are doing is exposed to sound waves. When we move to MRI, MRI does not use radiation. This is why it is quite expensive. And what MRI uses are what we call magnetic fields.
okay,
So like MRI uses magnetic fields, and it is very dangerous too, because before you can even go for an MRI test, you need to check if you have any transplant that is metal. You have to remove all these metal things in your
yeah,
body or like around the system, because you know what magnetic field does. It
yeah,
drags it, it makes the attraction so much. That is why there are some accidents that are avoidable that happen with MRI machines if you only know the different aspects of it. So yes, that MRI uses magnetic field, ultrasound uses sound waves, while the rest they use radiation. So yeah, that is why I said that that's why I said something like ionizing and non-ionizing radiation to
yeah,
visualize the internal system. So yes, those are like we have other modalities, fluoroscopy, we have we have urography. We have
Okay.
those ones are contracts where they use radiation to visualize the body. Where we talk about like the urinary system and everything, and we have different other aspects that we use radiography for. Yes, ma'am.
Okay, thank you so much. Now let's get to you being like a student and radiography as a course. So what were
Okay,
I
ma'am.
mentioned a few of the courses you've done, like the psychology, the geophysics, which I probably never even thought. Like, I mean, I can study radiography. Why should I be doing physics again? And then psychology. Um, Prior to you like saying, okay, I want to study radiography, what were the things you thought you would study? Like, what were the courses or like modules you think you would take? And then you got to school and you're like, oh, different things, which are more important. They are really important. Like, what was
Okay.
a shock or like a surprise or whatever?
Okay, if I'm being realistic, because I think what most people do online is just they just tell you guys a good part of everything. But if I'm being very realistic, I never knew what radiography was until I was in my 200 level with
Oh,
university. And even while I was in the course, I did not know what it was. So it just happened that I was studying biochemistry, and biochemistry is a really good course. Like I am in love with biochemistry because it makes me think a lot and it's like very practical. But something happened with my result that I had to opt for a transfer to another department, and I had a good CGPA, so I just opted for a medical course. I wanted to go for nursing because that was what I wanted initially, but because of the whole transfer, nursing does not accept I could not get nursing, or I did not later apply. So I now applied for radiography because I was just saying, oh, if you study radiography, you will leave the country. I'm like, eh, who doesn't want to leave the country? I just picked up a transfer form. Although I did my research, I just researched that radiography is a medical course. Like I don't even
okay.
know what made me take that leap of faith because it's not something that everybody will be so particular about. But I took that leap of faith. Then I stayed in the course. It's inside the course I started doing my research. So before prior to the course, I did not know what it entails. I even thought that they worked in radio stations. That's why I take my time to debunk certain myths in
Yeah.
radiography online. So like I thought there were those that work in the radio station. So
Mm.
while I was in the course, I started doing my research. I started seeing different diverse modalities. I started seeing that our equipment are so wonderful. I started
Yeah.
seeing that technology in radiography is a lot. I started seeing that I cannot even it's like it's not compulsory I stay in one particular sector. Currently,
Mm.
I want to be an obstetric sonographer. Like it's currently still in my field.
Okay.
So like when I started understanding that there are diverse places, some of my friends they want to study oncology, they want to be radiotherapists. Some of them want to study, some of them want to have different places. Radiotherapists are the ones that help in treatment of cancer. Some of them
Okay.
want to advance and start using radiography in industries. Some of them even
Mm.
want to be entrepreneurs in radiography. So, like, it was while I was inside the course that I started seeing that there are so many beautiful modalities, different sectors in radiography that I can specialize in. And the fact that I am daily interacting with patients, that was one of the reasons why I wanted to study nursing. I wanted to have a direct relationship with patients. And when I
Yeah.
understood that the reason why we study courses like psychology, why we understand that communication is key, is because we are daily and constantly having communication with patients. So that is one
Yes.
of the things that I love about radiography. You are you need to build empathy, you need to understand communication.
So thank you for your thoughts and thank you for everything you've shared. So just the last thing, what would you say to somebody that's like following this episode, person desires, okay, I would like to study radiography, or the person is already studying radiography and is like, see, let me just finish. I don't care whatever. Let me just get certificate and go. What will you have to say to people in those categories?
Okay, I would say first of all that I've gotten a lot of opportunities by just studying radiography, like a
Mm,
whole lot of opportunities. From because it's something that is not limited to Nigeria. It's something that everywhere around the medical field. So it's something you will be is diversified. I've met people online, mostly LinkedIn. If you're a student
Okay.
radiographer here, you should actually try out LinkedIn and just put yourself out there. You meet a lot of people, connect with people in your field and everything. So for somebody that is looking to, or should I study radiography? First of all, we are the eyes of modern medicine. They don't just call us that because they want to call us eye of modern medicine. It's because we're actually a good part of of the medical field. We are the ones
Yeah.
that you have to meet before you treat or diagnose a patient. So
Mm-hmm.
radiography as a field is very diverse. You are not limited to just one practice. You can after university you don't just stay in the X-ray. You can do further research. You can be a radiologist. I'm sorry, a radiation physicist. Like you can go in that. Okay, no, you can go in the field of being a sonographer. If you
Yeah.
want to be radiotherapist, if you want to be so versatile in nuclear medicine. Like you can go in those different areas. Like there are so many fields in radiography that most
Mm-hmm.
people don't even know until you study the course, until you do your own research. And for those that are in radiography already, I'll tell you that you should explore, put your
Yeah.
mind to work, do your
Mm-hmm.
research. There are a lot of organizations. There's I attend programs with ISRTT. I attend programs with Gamer. Like there are a lot of opportunities online that give you both certificates and practice that you need when you are done with the course, so that you will understand that this practice is actually one that is needed, and like you as a
Yeah.
human, you as a medical practitioner, you are needed in the medical field to save lives. Yes. So those are my parting words for anybody that wants to study radiography. Take a shot at it. You actually would love it a lot if you are really interested in interacting with patients. If communication is something that you need
Mhm.
or like you love so much. So yes, ma'am.
Yeah. All right. Thank you so much, Gifts. You can. I
Thank you
want to
so
say
much, ma'am, for having
to study radiography, but no, I'm going to stick to my microbiology. Thank you so much for coming and thank you for everything you've shared.
me
I
so
just
much.
wanted, I really appreciate you with that. The student who is not even done with learning the first degree of your course, you've got so much knowledge and understanding of what you're doing, and it's a
Thank you so
privilege.
much, ma'am.
It's rare, yes, it's rare. That's the truth. To somebody in first degree that can say this much about a course. So thank you for what you're doing. What you're doing on LinkedIn. Follow her on LinkedIn. She's always throwing vibes like you people must understand radiography by force. So follow on LinkedIn and you get so much.
Thank you
Thank
so much,
you.
ma'am.
You're welcome. All right. See you in the next
Thank
episode,
you.
guys. Thank you.